So let's talk about some other questions. Let's think forward. We're always thinking long term. 2026. What are the major changes that's going to happen when it comes to Medicare?
Yeah, so what we're seeing more and more with Medicare specifically is on the prescription drug side of things, the Medicare Part D, that we've already kind of briefly talked about how it's so important to review. And that's because Medicare is getting more strict on these insurance companies to be protecting the consumer a lot more. So putting actual limits on it, where 20 plus years they've had drug coverage, there was no limits.
Gotcha.
I'd see some pay for $5,000 on these expensive medications. Now there's a limit of $2,100 next year for 2026. Now, even though the Medicare picks up majority of the cost after you've hit that limit, you don't pay anymore. These insurance companies still have to pick up a portion of that.
Yeah.
And they're still learning the new statistics for it. So they've been used to the old system for 20 years. They knew how to work the system perfectly, and they're still figuring it out. So we're seeing on the original Medicare side, if you have just a standalone Part D plan, we're seeing a lot of premiums increase quite a bit because that's their only way to be able to adapt. We're seeing on Medicare Advantage plans more reduction in benefits, a little bit less dental, vision, hearing, and all these companies have different philosophies on how they handle it. Some more perhaps reduced added benefits, some have added deductibles or increased premiums. So we're really seeing a big change driven because of these drug plans being better for the consumer. So it's a better overall thing, but they're still adapting. You're going to see a lot more changes than you have in the past couple of years.